Greetings, I'm Beth Kelsey, the editor of Women's Health Care, a clinical journal for NPs, the official journal of the National Association of Nurse Practitioners in Women's Health. The journal is published 6 times each year, and the next issue will be coming to you in December. I'd like to share with you a few highlights of what you'll find in this issue. First, if you want to learn more about endometriosis and earn continuing education credits, you'll want to read our December CE article, Endometriosis Care, Women's Health Nurse Practitioners Share Perspectives. Did you know that it takes an average of 8 to 10 years between the initial presentation of symptoms and the diagnosis of endometriosis? Nurse practitioners are key to early diagnosis and initiation of treatment for this often chronic and progressive condition. For this article, a panel of 6 experienced women's health nurse practitioners convened to share insights and expertise on essential aspects of endometriosis care. They review current modalities for the assessment and diagnosis, discuss medication therapies, and address the importance of quality of life, patient education, and shared decision-making. Now, we know that cardiovascular disease is the leading cause of death in women in the United States. About 1 in 3 women will die from cardiovascular disease. Evidence suggests a link between particular adverse pregnancy outcomes and cardiovascular disease development. The article, Development of Cardiovascular Disease After Adverse Pregnancy Outcomes, explores hypotheses about the underlying mechanisms for this association, identifies several adverse pregnancy outcomes with potential links to cardiovascular disease, and suggests strategies to optimize cardiovascular health following adverse pregnancy outcomes. Now, in our On the Case department, the authors of the article, Providing Culturally Sensitive Evidence-Based Care for Orthodox Jewish Women, provide insights into some of the Orthodox Jewish traditions that influence sexual and reproductive health and choices. Orthodox Jewish tradition requires married women to abstain from physical intimacy with their husbands whenever they begin a menstrual flow or other vaginal bleeding, and until they count 7 days after the cessation of blood flow. The authors explore the reproductive years of an Orthodox Jewish woman as she navigates different scenarios from bride-to-be to achieving pregnancy, using contraception, and moving into perimenopause with irregular bleeding. Each of the scenarios guides the nurse practitioner in providing culturally sensitive care. So watch for the email that lets you know the issue is available online, and if you're an NPWH member, check your mailbox in the middle of December to find your print copy. Happy holidays.